Many of us have experienced this long before we actually become doctors. Even as students, the moment we put on a white coat, the world begins to treat us with much greater deference. Possibly that is why we see white coats worn outside hospital premises, which, by the way, of course, isn't appropriate. But it does raise an interesting question. Why does that deference come into play at all? It's because society accords doctors a certain level of respect and credibility by default. Along with that comes a kind of de facto leadership. Not something we ask for, and certainly not something we are formally trained for, but something that's quietly granted to us nonetheless. So let me ask you, when was the first time you realized someone was looking to you for leadership as a doctor? Maybe you can drop the answer in the chat. As our careers progress, these expectations only expand. What is striking is that while clinical training prepares us rigorously for diagnosis and treatment, we are rarely taught how to use this influence effectively for the benefit of our patients, our teams, our professions, or society at large. That realization is what brings us to today's session on Oral Pathology 360's Oral Pathology Tuesdays. Hello, I'm Dr. Mandana Donahue, your host for these sessions, and this one is extra special because we are sharing the stream simultaneously on Oromed 360 Academy. Together, we will be exploring leadership in the dental profession not as a title or position, but as an everyday reality that begins far earlier than we often acknowledge. And to take this conversation forward, we are joined by Mr. Suri Babu K, founder and principal at UnivEd International, with over 30 years of leadership experience in the pharmaceutical and healthcare industry, building and leading large multidisciplinary teams in highly regulated health environments. He brings a very grounded perspective on leadership in practice. So let me bring him in and
Hi.
yes, hi and welcome. It's wonderful to have you with us.
Sam.
So let's move on. I think watch the lecture and then come back for further discussions. Okay.
Hi everyone, greetings to you all. This is Babu from UnivEd International, India. At the outset, I want to thank the leadership team of Oral Pathology 360, Dr. Mandana, Tanaz, and everyone. Very happy to share my thoughts on this wonderful topic, excellence in dental profession through effective leadership. I just want to talk about UnivEd International briefly. We are committed to creating leaders without title across all the levels. We are a coaching, mentoring, leadership competence development company. Short note about the rights of the content of all the slides. These are reserved with UnivEd International. When I was researching about dental profession, I came across many fascinating facts about this profession. I'm sharing some of the details that I came across from American Orthodontic Association. I read that dentistry is one of the topmost sought after professions and offers the highest level of job satisfaction. And you find many dentists in US. For every 1600 people, there is one dentist. And this dentistry is not a recent profession. It has been existing even 5,000 years ago. And those days, in fact, they were using beeswax to fill the cavities. This is one of the practices they followed. It's one of the top jobs in US, and especially the surgeons in this area, they are the best paid dentists. It's a lot of scope. Uh, but 80% of the dentists they choose to practice general dentistry. But again, there are also 20% of the dentists they focus on specialized areas like orthodontics. Very interesting profession. So, what is professional excellence? We were going to talk about excellence in dentistry, then effective leadership team. The concept of excellence in any profession can be very subjective. Different professionals may have different opinions about it. What they consider as an excellence can be really different from what another person considers. Let's actually do a deep dive into it. Irrespective of your profession, excellence can be defined as a success or job satisfaction or sense of fulfillment or the money you make from these or the lives you touch or the social impact you create. It can be anything. Maybe at the start, I suggest you all to pause and reflect and rate how you rate your own professional excellence. Maybe how excellent you are according to you in the field of dentistry. I'm suggesting you all to do one reflective exercise. You don't have to do it now, but I can suggest you to go back and actually take some time and reflect and let me do this exercise, and this can really be very revealing. At the start, maybe you can make an exhaustive list of all key excellence indicators which you consider very important in terms of reflecting excellence in your profession. It can be money you make or the name, fame, the trust you gained of patients. You have many repeat patients, the number of patients you see, or the work-life balance you get, or maybe sustainability. You're actually positioned to stay even for decades in the field, or the sense of fulfillment you are getting from this career. So whatever it is, maybe on a scale of 1 to 10, 10 being the highest and 5 being the average, you can actually do an assessment of your own excellence, and then I think identify wherever you are scoring less than what you consider as good score. Maybe I think you can identify the gaps, and that's why I think it can be very reflective. It brings I think a lot of self-awareness. This is my suggestion. Then why are we talking about leadership? I mean, the topic says effective leadership and professional excellence in dentistry. I know the word leadership is predominantly used in corporates, in organizational setup, but how is it relevant in your profession in dentistry? Especially when you're talking about clinical excellence, treating patients, etc. You may even ask, who's the CEO in a dentistry? Do we have a board of governance? So all these questions can come up. So why are we talking about leadership? The most important thing is in clinical setup, in healthcare professions, I agree that leadership terminology is not much used. There is actually a neglected gap between the expertise and leadership effectiveness. I'm sure you agree with me that the one who is considered as an expert in the field of his clinical area, not necessarily can be considered as an effective leader. Because there are some people, majority of the people, they practice their profession, but again, there are some people who go beyond the mere dental expertise and they leave a mark. Let's actually understand more about it. So the key message I want to share with you all is that professional excellence has several dimensions like you had seen, and it's not just mastery at work, right? No, but again, it's much more than the expertise that you demonstrate at work, and it has many dimensions. Let's understand more about it. So relevance of leadership, I want to talk about more about it in dentistry especially. The complexity is increasing to understand effective leadership in dentistry because technology is evolving day by day, and customer expectations are ever evolving. The demands are ever changing. The competition is increasing. Like we have seen in US, there is one dentist for every 600 people. There are also a lot of ethical dilemmas. The practices, the treatment, what you suggest, sometimes whether they're required, are they preventive, or they're therapeutic. If they're preventive, do you still have to strongly recommend when especially the patient have to pay from their pocket? So a lot of these ethical dilemmas actually are going to come, so that makes the profession and the application of leadership in dentistry very complex. So I teach quality management system for products as well as for service industry, and so one thing I learned is the quality in service industry is very complex. In dentistry, quality is nothing but patient care. Patient care is a service. So the quality of patient care is very difficult to measure because services are abstract, where if it is a product, you can always say the product is defective, you can always ask for replacement. Whereas after a process that you have done in your clinic, so how do you really quantify the the quality of the service. It's very complex. And there are also a lot of emotional factors. Even if you've done your best, sometimes patients may view certain things through the lens of emotions and the maybe the way they perceive the interactions, the care, the warmth, the compassion. So all these things can really, I think, make them right, rate the service in a different way. And when I'm talking about compassion, warmth, emotional factors, so why a customer, a patient has to come to you again and again? How do you get repeat calls? Especially when the service is actually highly subjective. The quality of the service is highly subjective. It's abstract. So that's actually an interesting point that you all should know. So in such cases, when service actually is very difficult to quantify, the retention can be a big challenge. Nowadays, patients also have a lot of options. Like I said, there's so many dentists, there are so many dental clinics around, and a lot of alternatives are there. Even like I think there is also I have seen actually a presentation on homeopathy in dentistry and Ayurveda in dentistry. A lot of alternatives are there. A lot of home remedies are also there. And some loyalty is also shifting. So how do you really retain your patients, your customers? How do you make sure that they come to you again and again and again whenever they have a problem? So this is the reflective question I want all of you to ask yourself. How do you ensure sustainability of your business, your profession? Then second question, how do you future-proof your profession, especially when competition is increasing and patients have more and more options, alternatives, and they can choose not to come. And also there is a very stiff competition. Then how do you actually future-proof your profession? Question number 3, reflective question. How do you achieve excellence beyond clinical mastery? Yeah. Now, if you look at patients as your customers, certainly they are customers. I was thinking over what are their expectations when they come to your clinic. Of course, certainly high quality of service, although this is very subjective. The value for money, I mean the cost competitiveness, and the variety of services they get within same clinic with different kinds of treatments, in maybe pharmacy attached, so whatever, the diverse options. Then care and attention, we talked about emotional factors, the warmth, the compassion they receive from not only from the dentist but also from the staff. The speed of service, whether they are made waiting for long time, for long hours, the ease of access and transaction, how is the process for taking an appointment, that how is the uh, transaction if they want to pay, and then how many levels they have to go to get the treatment done, right? All this is the ease of access and transaction, right? So there can be many more demands of customers. Okay, these are just a few, these are not all exhaustive list. So when patients have such an exhaustive list of demands from dentists, what you need is a leadership approach, not just clinical expertise. So that's why I'm just saying the gap between the skill and leadership is existing. This is a neglected gap. So those who just practice the profession versus those who lead beyond dental expertise, they become successful. So success and service, they are interrelated. When you provide the best service, you become most successful. When you become most successful, then actually you get more opportunities to serve. They are interrelated. So this is where the approach to leadership, application of leadership in dentistry can really in fact boost your professional excellence. So that's a central theme of my talk. So I came up with a 4V formula. This is my own. And the professional excellence for future proofing your career. There are the 4 V's that you can consider as a predominantly essential. Value you bring, the visibility you have, sometimes it can be publicity through media, the reputation through word of mouth, actually you get more and more customers, patients, the reach, the access your clinic has, how reachable are you, is it easy to take an appointment, the location of your clinic, That's all actually visibility. The versatility, like I said, do you provide diverse categories of services, a variety of options under one umbrella? Is your dental clinic one stop solution for different problems? And the values that you display. Not only you, the staff in your clinic, your attendants, your support staff, your right from your receptionist, the person who gives an appointment, right? The pharmacist who gives the medicines, everyone who's participating in the entire process, how well they display the values when they are dealing with the patient or the customer. So all these four V's, I think no, they are actually if you have done a best job in giving your best in the four V's, I think that's going to define your excellence and help you be sustainable. So how to boost practice? This is actually one slide I have made. A few thoughts, not all exhaustive. Of course, ambience of your clinic, the patient-friendly setup, especially you are dealing with pediatric patients, it has to be child-friendly. Then, like I said, multiple services under one umbrella, one-stop solution. The work hours have to be convenient to the patients, and also providing preventive care and guidance, not only a treatment. Then sometimes you may not make a business, but again by providing the guidance as a service, as a no cost service, you may in fact attract more and more customers. The leveraging social media, the visibility is important, like I mentioned on the previous slide, and also constantly upgrading yourself, your clinic, and even your skills, and even the skills of your staff. Everywhere, of course, automation is being implemented. AI driven processes are actually widely being used in many places. So, are you upgrading yourself on daily basis? This is what is very important in boosting your practice. So, I came up with a 4D model, four domains of effective leadership for excellence in dentistry. I'm going to discuss in upcoming slides. So, effective leadership starts with self. This is primarily your self management, self leadership, and inner control. Unless you are best in this, you cannot really be best in your outer world. Everything starts with self. Then, leadership of your people. The people, what I mean is your staff, your partners, the stakeholders, everyone actually that you are working with, even maybe the regulatory bodies that you are working with, even the neighborhood, all the people, how you are actually working with them, how you are leading them. Not bossing. When I say leading, it's not bossing, how you are actually managing them. Then leadership of patients. This is self-explanatory. And leadership of the system, the ecosystem, the environment you are operating, the profession you are actually operating in. So we are going to discuss more about it. So all the four pillars are interconnected, equally important. Even if one is weak, the structure becomes very shaky, and your profession and your practice become very shaky. The first one, self-leadership. Predominantly, I want to actually highlight the importance of three sets of approaches: skill set, mindset, and heart set. Skill set, of course, is self explanatory. Your expertise in the field, your competence, your continuous learning, upgradation, right? Then also ability to make decisions when you are not able to maybe diagnose properly, and when there is uncertainty, and the ability to work under pressure and even stressful situations. Then your planning, prioritization. So everything actually comes under skill set. You really have to be good at that. Then mindset. Are you operating with a growth mindset or fixed mindset? Are you thinking about long term establishment, or are you focusing on short term game? Are you trying to fix the issues, or are you trying to take excuses or blame somebody? These are actually your mindset related aspects. Then heart set, like I said, compassion, warmth, the emotional quotient, emotional regulation, the ethical approach, all the come under heart set. The way actually you put your heart in the game than your mind. So these are very important because we also, I think, have seen that emotional factors of the patients play a big role in perception of the quality of the services you provide. People leadership. I already mentioned that the people who are participating in the entire setup, whether it can be your team members, your attendants, the receptionist, your partners, if there are some investors, then the neighborhood, the everyone actually, is a key player in the game. The philosophy I apply is, if you consider everyone as an important player in the game, nobody actually is an umpire, nobody is actually commentator, nobody is a spectator, everybody is a player. So there's no single captaincy. There's actually, it's a shared captaincy, shared accountability. So to establish such a mindset in people, you need to have a strong culture, a culture built on values. So that's very important. If your culture is weak, you'll not be able to really create this kind of culture of accountability. That's very important. So again, the trust-based actions and transactions are very important when you're dealing with the people. Even across your team members, who does what, the role clarity, the goal clarity, the understanding of the processes, the authority to make exceptions, maybe to make decisions in times of maybe crisis, and also when things are not going well, maybe the tendency to coach the people than criticizing or commanding, and conflict management through greater good focus. There will be certainly a difference of opinions, but again, as long as all the members of the team, they see things through the lens of greater good, I think they'll be able to resolve through conflicts very amicably and work together as a team. So you need to actually build such a culture in your setup. That's very important. Patient leadership. Trust is the key in any relationship, and so even in patient clinician relationship. The compassion you display, the communication clarity, the authenticity you bring in your communication is all very important. And we are talking to a patient for any procedure or for any diagnosis or any decision, any clinical decision you want to make. It's very important that you take the patient with you. Consent driven approach. Shared objective. Wellness is the shared objective. Maybe relieving the patient from pain is a shared objective. So when you display this shared approach, and you are going to actually win that trust. Certainly, of course, this is a business organization, but again, certainly, if you convince the patient that you are partner in the entire process, you are very authentic, you are not choosing monetary gains than patient gains, then I think you are going to win the trust and you are going to see good partnership between the patients and the clinicians. And again, focus on building long-term relationship over short-term gains. You may not actually see the patient again, but again, it is okay. You may not actually even do any service to the patient. It is just an inquiry. But again, the way you deal with these inquiries, although there is no assurance of signing up with the clinic, if these are dealt through compassion, through trust, in a positive way, then you will be remembered forever and reputation goes a long way. All the patients, no one is exceptional. Majority, I can say at least, they come to clinics with a fear, with an anxiety and with an uncertainty. So you should have a knack of managing this and give assurance and show compassion and be seen as an authentic clinician. I think that goes a long way. Like I mentioned, there may be a lot of inquiries, but again, nobody actually signs up for a procedure in your clinic. But you should have a grace in handling with such withdrawals and non-conversions, because they may always come back to you. They may become your brand ambassadors. That's very important. So respectful acceptance of patient choice. You may suggest 1, 2, 3 options, but again, patient may choose none of them, or they may opt for something else. You really have to respect, because you've done your best in communicating the issue very clearly authentically without actually wearing the hat of businessman, purely in the interest of patient wellness. And when you do your job, but again, it's up to the patient to make a choice, and you have to respect that. Remember, human beings are emotional bodies. Then you really have to make sure that their emotions are respected, and their choices are respected. So these is where actually ethical practices come. You don't really insist on certain practices when you actually believe that these are very important to be done. Of course, you share your perspective, but again, you don't really rub on the things in any way. And also, you don't really resort to uh, suggesting any practices when you know that they don't require these treatments. But again, just stay away from the temptations of recommending the practices which you really don't feel essential for them. Systemic leadership. Systemic leadership, primarily it goes beyond your people, patients, and yourself. It covers the clinic, your own clinic, the ecosystem, and the profession overall. So, what is systemic leadership? Primarily, we can actually divide the entire system into three categories: the micro system, there's a clinic you are operating in; the meso system, the ecosystem, the how the dentists are produced, trained, and developed; and the profession of dentistry, there's a macro system, right? So always operate with the vision of the bigger picture. How does the clinic run, right? And what are the practices actually you have to build in? The standard operating procedures, the training that are to be given to the staff members, the selection of the staff, the ambience. I already mentioned about ambience, right? The warmth actually the people show to the patients and to each and everyone, right? The technology you are bringing into your clinic, right? Now, how you are constantly upgrading it. This is actually at micro level system. You really have to manage this very well. That's the first and foremost super important. You just don't stop at that. You also focus on the meso system, the ecosystem, how dentists are trained and developed, how the institutions are, education systems are running in creating more dentists to the world. Okay, and the the bigger macro system, the profession. How is the profession trusted? Is dentistry a trusted profession? Of course, it's very popular nowadays. We have seen this, but again, how do people treat dentists? Are they respected? How society reacts to the dental procedures, the dentists? So there is actually the bigger macro system, the profession. So you need to really focus on leading all these three systems very effectively, efficiently, and selflessly. In India, we have read ancient Sanskrit verse that reads like this. It's written in Sanskrit. I'm just reading. Sarve jana sukhino bhavantu, loka samasta sukhino bhavantu. The literal translation of this is in English is, may all people be happy. May all the worlds or societies be happy. It has a very noble concept in this. And this applies to every profession. With reference to application dentistry, how it gets translated? It means systemic leadership in dentistry seeks the well being of all patients, teams, institutions, and society at large, placing your individual benefit below and benefit of everyone above everything. With this, I want to conclude my talk, and thank you everyone once again. These are my contact details and UnivEd International's contact, and please feel free to connect with me if you have any questions or queries, and if you are looking for any additional coaching, mentoring, leadership development training services, happy to serve. Thank you everyone.
Yes. Thank you. That was an interesting, I can say, a short sort of introduction to the whole concept of leadership. Uh, it's a very interesting view for us to see it from a different from the purely leadership part, you know. So it was very interesting. And I hope everyone will put in their comments and questions in the chat. Actually, what has happened, and I will have to apologize to part of our Oral Pathology 360 audience, is that the live stream link changed for some reason as we were going live. So, where people are waiting, the stream is not happening, it's happening on another link. I have been sending the link, but well, I think majority will end up watching it afterwards. So, right, let me finish sharing this few little bits of details that we have. One is, of course, for those who have our uh, who are members of Oral Pathology 360. Uh, you're a part of the community. You can get a certificate. Of course, watching is always free for everybody, but if want a certificate, you have to be a member. To become a member, just click the join button below. And then what you need to do is, of course, attend the live stream, type something in the chat so we know you're there, and then we will be sharing the link to the form for for the registration for the certificates in a post. So that is about that. And then okay, let me also say that we had some new members joining us, and I would like to thank all of them. Very welcome to the community. It's great to have you all. And one last wrapping up comment, and that is about our flagship conference, the International Oral Diseases Case Presentation Conference. The fifth edition is here, and the registration will open by tomorrow. We will share the link. In fact, as we were sitting for this, I got the go ahead from our tech team that by tomorrow we will be able to open the website. Keep an eye on our various pages and our email and wherever we are, and you will get the link. With that, let me hop onto the actual chat and see what's happening. Oops, why are you not there? Okay. Sorry. Uh, yes, you got locked out before, right?
Yeah, yeah. Sorry for that.
Right. So let me just do this. This is not working. Sorry.
So can you hear me?
I
Or
can hear you. I just need
can
to get your picture properly in there. Yes. So let me add you to this scene and we will be good to go. Yes, there you are. Now I can just delete that. Yes. All right.
okay. Yeah.
Yes. So let's see what's happening in our comments. Okay, let me first say hello to everybody. Hi, Tanaz. Hello, Dr. Madhura, Dr. Sachita, and of course, Dr. Joss. So, yes, I can't see any questions. Uh, I have to ask myself now. You know, a lot of what we read very often, if you start reading about leadership as against being management, okay, so the typical or a very interesting comment or writing that I have seen is that a manager will start clearing the forest, a path through the forest. But the leader will get up on a tree and tell you whether you are in the right forest or not. This is something that has always stayed with me. So, how do you think as doctors, because we are, of course, running a lot of things, let's say in a clinic or, as a teacher, how do we avoid becoming managers, just good managers managing every day on a routine basis, as against being good leaders?
Right. Yeah. I know. So can I start?
Yes,
There is a,
please.
yeah, in clinical, there is a network.
There's an
You,
echo.
yeah,
Just turn off that offstage feeds,
okay.
which is at the bottom, and see if the echo goes
Yes. Now it's
better.
I think it's better. Okay, I'll continue. It's okay for you, right? There is an echo
Yeah,
from
it's
again.
okay this side. It,
Okay,
this side, it's
fantastic.
okay.
Yeah, I'll continue. Yeah, and certainly in clinical setup, it can be very
No, okay,
interesting.
sorry, I got to interrupt you. It is not okay here either. Can you just check and see whether on any other tab you are logged into, maybe YouTube or this same program anywhere? Especially if YouTube is open somewhere.
Okay, let me check. Yeah, in fact, I joined multiple times, certainly that's true.
Yeah, if you can just close all those other tabs.
Yes, now is it okay? Yeah.
Hmm.
No.
No, not yet. Um,
Do you see me? Do you see my name twice in the
from that settings wheel at the bottom, just below our this central image, just open the audio and turn on echo cancellation.
I'm a technology with yeah, I'm just trying to
Okay, let's try now.
hello? Is it
Yeah, okay, try.
Oops, is it okay?
Just keep talking, we'll see what happens.
Okay. It's not a- Yeah, in clinical setup, I mean, prepared to operations, certainly it's very tricky and very interesting. That I mean, what there does, I mean, what clinician as a manager versus as a leader. Yeah, I mean, most of the things, man, running it when you're running your clinic, I mean, you certainly most of the time act like a manager, getting things done, keeping the house in order, right? Ensuring that there is I think, great enough service provided to the patients. But I think as a leader, you also take people along. I mean, create a sense of shared accountability in giving the best, in ensuring the greatest level of service to patients. So that sense of, I think, accountability, right, uh, is cannot when you're operating like a manager. Yeah, you inspire a commitment to serve. It's a certain we are all doing business. I don't deny that. But again, so you in fact ignite the teacher spirit, yeah, higher level of thinking, much more than like treating the services as a business transaction that can only can come when people see you as a leader. I'm just one example. But in the how things how you can do, like I mentioned in the three six systems I have covered in the ecosystem around in the system, the entire profession. You can actually go beyond your clinic and be an exemplary clinician. I think leave a better impact in the society, in the profession. I think that's it. A
Right.
clinician has an opportunity to, act, act in the direction.
Right. Sadly, the answer is not very clear because it's breaking up quite a bit. And so I don't know what the audience is feeling. Oops, sorry. Let's ask them. Is the conversation clear, folks? But we have one question. So,
Okay.
yeah. So, how do you manage the if the patient wants to prove his point even though he's wrong? This is from Dr. Nayak. Yes. I guess
But,
especially today where everybody has the chat GPT MD with them. Yes. Yes, Tanaz is telling us that your voice is breaking up.
okay.
Uh, okay.
So
You
what do you
want
think?
to try just exiting and coming back again, and we'll see.
Sure, sure. I think I'll do that.
You just do that and then close all the browsers and then come back in. Remember
Sure.
to come back in through Chrome. Yes, folks, sorry for this. Technology finally sometimes it just happens. Okay, so while we are waiting, I can see I think today most of you have joined in from Oromed 360 Academy. So while you are there, please do subscribe to the channel. Yes, that will be nice. And that is if you are not already subscribed. I know some of our regulars have already been with us on that channel for some events and have therefore subscribed. But well, you can do that. And the conference website, which we are launching by tomorrow morning, I mean, by this evening actually, is this time not on the Oral Pathology 360 website. This time it has its own website. So it is actually 2026 dot iodcpc.com. So every year it will be having its own website now. And of course, starting with the year, so it just sort of keeps adding up.
Enough.
Okay.
Yeah.
Yes, let's see.
I think it's good now. Yeah, I don't
Yeah.
hear the echo now. I think this is
Yeah,
good.
it's much better now. Okay. Yes,
Fantastic.
now you can answer.
Yes. Yeah. So how do you manage the patient who wants to prove his point even though he is wrong? Okay, these things can happen. I think now you just mentioned about ChatGPT, Mandarathan. We all have the Wikipedias in your hand, and so we are more educated. Sometimes the doctors, yeah, and yeah, I think it does that. But I see, in fact, even my close family member, they do that before they go. They do Google and actually they go with a lot of information. Yeah. So I know it requires, of course, certainly knack of convincing I think a half-educated, yeah, it's in fact talking to a half-educated person is, I think, not easy. At least if someone comes with a blank mind, it's easy to, I think, put forward your point. Yeah, you may have to really deal with the patients. I think certainly it comes with practice. I think it's similar to how you maybe if someone has kids at home, small children, maybe I think bringing up children. I think they will ask probably I think a lot of inquisitive, challenging, rebellious questions. I think parents have to deal with them with a knack, I mean, with warmth and with compassion. I think again I focus on the words warmth and compassion and the I think like I said authenticity, and I think when you are actually operating with this, then I think patient I think will get convinced that maybe you really have to say that. Yeah, maybe yeah they may not be able to understand well, but again the moment actually they see your sincerity, then your I think yeah your honesty and right no, I think your authenticity and your shared commitment to right no commitment shared commitment to their wellness, right no, health. I think they should be able to. I know it's not easy. I know I need to give a proper answer, but again, it's a practical issue. Yeah.
It's a practical issue. And actually, what I think this goes a little beyond leadership. This is
Yeah.
going to fall within the realm of negotiation skills.
Negotiation. Yeah. Right.
Yes.
Absolutely.
I know
Yeah.
again this is something we don't think of in the medical or dental practice that we need to have negotiation skill, but
Yeah.
finally it's the same thing. You
Yeah.
are trying to convince someone, make them understand. I guess it is to some level a negotiation skill without uh, alienating someone or making them feel uh, ignorant or in some way lesser,
Yeah.
without sort of talking down to them, but treating them as an equal and building that knowledge.
Yeah.
It's going to be difficult. It's not as easy as it is said this way, but yeah, I think
It's not
that's
easy.
about it. Yeah.
Yeah.
Right. So Tanaz is asking us something. What, according to you, is the top three most important leadership skills dentists should inculcate?
Leadership skills. Okay. I put actually communication skills at the top, certainly, because through communication, of course, you will gain the trust, and you will also be able to inspire your own team members. You will be able to put forward your point well. Like when we have people who are already knowledgeable, they know about a lot of things. I mean, like I said, thanks to Google and ChatGPT. Yeah, sorry, there was an incoming call, so it got disconnected. Yeah. So and also I think yeah, yeah, I think communication is important. You want to share your vision, quality mission, and across your setup. I'm using the word organization, but again, everyone, right from the receptionist to your staff, support staff, everyone has to really operate at the highest level of sincerity, commitment, service mindset, servant leadership. You really have to have fantastic communication skills, influential communication skills. That's very important. Second thing I you consider is interpersonal skills. They go hand in hand. Certainly, they go hand in hand. Like you have a difficult patient, or if you are a pediatric patient, certainly you know it. Sometimes maybe the kids, in fact, they resist. I think you how I think tactfully, in fact, you I think establish a rapport, win that trust, then make them actually accept you, but with less resistance. Of course, the zero resistance is like a imaginary, but again, you actually that all actually you develop. You exhibit a sort of a radiant warmth, right? So people feel really comfortable in your presence in talking to you. Like I think good interpersonal skills are very important. So how you carry yourself, like you radiate the positivity, right? Then sometimes maybe there may be disagreements, different opinions. Like earlier, previous person who asked that question, right now about a patient who is not agreeing to your point, still actually you don't lose cool. Use your emotional quotient, right? So that's how I think you really have to deal with the people. People are of course emotional bodies, so that's interpersonal skills I put as a second one. Third one, certainly, yeah, I'm just thinking first two were very easy for me. I was able to pick up. Yeah, maybe I think in negotiation, maybe I think I'll put it Mandana. I'll pick from what you said. Yeah, I think.
Yeah, but one point that you said is how you present yourself is very important.
Yeah,
And I recall when we were students, I mean, when I was doing my BDS, it's 30 something odd years back. But the point is that the setup in a dental school is especially when you are learning, and that habit stays. So our
right.
teachers used to try and break it. Is you are given a case by your teachers. You go and do this filling, or you go and do this extraction, and you tend to just walk up to the patient and do whatever you're supposed to do, right? So I still remember our teachers used to really get mad if we did that. And said, you can't just walk up to a patient. They're not a thing. They are not, a piece of machinery. You're supposed to walk up and introduce yourself, explain what you're going to do. Yes, the patient knows he or she has come for an extraction and you're going to extract the tooth, but you have to explain it. You have to say exactly what the steps are. You have to, establish a rapport. uh, it's not the machine you're working on.
Yeah,
And this used to be, sometimes almost all of us have got numerous school rounds of scolding before we developed the habit. And I think that's very important because maybe, like you said, it's from when we are training, this has to be inculcated so that I would say, even if you are in your own clinic,
right.
the patient knows who the person is. A doctor's name is obviously there when they come in. But even then, I think you should take the moment to introduce yourself, because most likely your nurse or somebody has taken details outside, but now you are talking to the patient, and that interaction needs to be there.
Absolutely. Yeah, and the
Yeah.
warmth actually goes a long way. I think I have seen, in fact, even including myself, my family members, when we have one family doctor, Starts cutting jokes the moment actually he sees us. So I think he has won half the battle. That an
Yes.
acceptance is established. Yeah, yeah. So I think even if the doctor is fantastic, his clinical expertise scores really high. But again, if he fails to establish the emotional connect with the patient, then what happens? No, people actually miss actually such a skilled doctor. Yeah,
Yes.
they will not go
Yes.
to him again and again. It's a wasted talent. So I think so interpersonal skills and developing the ability to connect with the patients actually is very very important.
It is. It really is very important. And I still remember this from our days of training that it was very important. Of course, I then went on and became a pathologist where we actually have even much less interaction with the patients, but it is still necessary. And I think it's a very important point that maybe nowadays it doesn't happen. And especially in this, like you say, your family doctor has seen you for ages and is used to you. And, there's a completely different rapport. On the other hand, in today's world of dentistry, almost every dentist has numerous other dentists working with them. There are specialists who just come in, do something, go away. Another specialist comes in, does something, goes away. And sometimes, even in my own experience with my own friends, when I go to their clinics, uh, you know, I know whose clinic it is, but the next doctor who has come, yes, I know so and so is coming, but that rapport is no longer there, and that interaction is not there. The And this is with me being, a dentist, and most of them are my friends. But I can imagine that as someone else going there, you will totally lose that rapport and that connection if it's sort of this kind of a transaction happens.
Yeah, it's very important. And that's the interpersonal skills certainly they appear in the top three. In fact, I mentioned in one of the slides, every patient goes to doctor. What's going to be the diagnosis? Either doctor is going to prescribe a lot of medicines, and the reputation nowadays is not good. That doctors prescribe unnecessary tests, unnecessary medicines. I think scare you. So we go with a lot of anxiety, fear, suspicion, skepticism. With that mindset, and patients enter your clinic, then first thing to do is actually calming them down and winning the trust. Then
Yes.
diagnosis can start.
Yes, that's very true. And I think doctors across the world in every discipline need to remember that we get comfortable in clinics and hospitals,
Yeah,
but for most patients, entering a clinic for whatever thing is
white
a
coat.
scary thing.
Yeah, white coat hypertension or something they
Yes,
say, right?
yes, yes, correct. Yeah, it actually makes people's blood pressures jump by something like 15 points.
Yeah, yeah.
Yes. So that these are very interesting things. Yes, absolutely. So we haven't got any more questions in there, right? But it's been a very interesting talk, really, very interesting. And this has always been on my list of things I should get in the channel, because I really realized very early on that this matters. It
Yeah,
matters that at least we begin to recognize that we have a leadership role, whether we like it or we don't like it. It's there, it exists, and we need to add it to the skills that we need to gather.
absolutely. I know this is a vast topic, and but again, yeah, at least I think if people recognize that, yeah, I
Mm.
think conscious efforts if they can make
Yes,
in directly applying some of the leadership principles, I think one at a time, I think they'll go a long way.
yes, absolutely. Yes. So, okay, let's. I think that's a wrap. And we had comments saying that it's a very nice talk, and thanking you for it.
Thank you very much.
And let me bring this one up. Yes. So we traditionally give everybody a little certificate as a token of
Thank you.
thanks, and it's sort of a keepsake to know you were here.
Certainly, it's nice. So nice of you. Pleasure actually being part of this noble initiative you have taken up.
Thank you so much. Thank you so much. So,
Thank you.
everyone, I think we have had a wrap, and we shall see you the next time. Be well, be curious. Remember, the Oral Pathology 360 Tuesdays will now be after 2 weeks. We have another interesting session, of course, lined up for you. Everybody, see you. Bye.
Bye bye.
Bye. And thank you so much again, Mr. Babu, for being here. This really made a difference.
Yeah.
Thank you.
Thank you, Vandana, for giving a chance to me. Yeah. Thank you,
Thank you.
Sanas.
My
Thank you very much.
pleasure.
Bye bye.